Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome to the Oncology Revolution Podcast. I'm your host today. My name is Raquel Maris. I'm an occupational therapist with an executive MBA working at the European School of Lifestyle Oncology. Today, I have the pleasure to welcome Krista Brown. She's an oncology nurse navigator and certified functional nutrition counselor with a master's in medical nutrition. She's also a breast cancer survivor and carrier of a high-risk gene mutation, bringing together both clinical expertise and personal insights. Krista's work ranges from hands-on patient care to public education, advocacy, and social media, where she helps make complex health information more accessible and empowering. Welcome, Krista. Thank you for being here today.
Thank you so much for having me, Raquel. I'm excited for this conversation.
Me too. Let's start with what pulled you into the world of oncology, and how did your own experience with cancer change your approach?
Yeah, so my work in oncology was really driven by my personal experience with cancer. My mom was diagnosed with breast cancer at age 48, and she was very healthy, and we had no family history of any kind of cancer that we were aware of at that point. And so it was really a shock to our family, and we were very surprised. So with no family history, they did offer her genetic testing, which at that time they were only checking for the BRCA mutation, and she was negative. So we kind of thought we were safe from the genetic point of view. And I mean, she went through 12 years of treatment, all kinds of treatment. So she did traditional chemo, radiation, as well as some complementary therapies and a more integrative approach. And she really was the best self-advocate I've ever met. So fast forward about 12 years into her diagnosis, or past her diagnosis, she was offered expanded genetic testing, which we weren't even aware was an option at that point. But they found so many new genes linked to different types of cancer that we didn't know of, and they offered her testing for those genes. And so of course, she said yes, and she tested positive for a mutation in her ATM gene, which gave her a risk of breast cancer, 69% risk of breast cancer, as well as pancreatic and ovarian cancer risk. And with those mutations, has a chance of passing down those mutations to each of her children. We all had a 50% risk of inheriting that from her. And so that led to my own testing. And I tested positive for the same mutation, and started screenings. They do more thorough screenings when you have one of these genes. And so I started screenings, started considering the option for a preventative mastectomy with that high breast cancer risk, and ended up getting diagnosed with breast cancer, stage 1A, about 2 weeks before my preventative surgery. And so stepping out of my nursing shoes and into the shoes of the patient really opened my eyes to a lot of the gaps that we have in our healthcare system. And especially when it comes to hereditary cancer. I reported my family history of breast cancer for 12 years. So from my mom's diagnosis every year, and nobody ever offered me genetic testing, which, has come a long way in a short period of time. And so there's just a huge knowledge gap, I think. And so something that I've become passionate about sharing with others. And so that really drove my decision to move into oncology. And so have now working as an oncology nurse navigator in hopes of helping people along their own journey. And so that's been really cool.
Thank you so much for sharing your story, and it's very touching. So I'm glad that you were able to open up and share the whole story. I wanted to know your perspective on the role of genetic counseling on oncology. Do you think this is something more people should be offered as a preventive measure?
Yeah, 100% I do. And I think cascade testing, which is testing family members of people with no mutations before diagnosis, is really where we're going to make the biggest difference in preventing unnecessary cancer diagnoses, right? A lot of, we hear a lot about these younger populations now, and the rates of cancer are increasing, all kinds of cancer, not just breast cancer. And a lot of people aren't aware. I know I wasn't until, that became part of my own story. But a lot of people aren't aware that there are so many mutations now linked to so many different types of cancer. So not just breast, but pancreatic, colon, prostate. So I just think that we need to be educating patients on this and letting them know that it's an option, so that they can be tested if they would like to, and hopefully prevent or detect cancer at a more early stage.
I completely agree with you. And I want to know your insights and how do you approach conversations with patients that are a bit unsure about whether they want to know or not if they have a genetic risk?
Okay, so I could totally understand not wanting to find out whether you're the carrier of a genetic mutation. I mean, it seems silly to me now looking back, but when I had the opportunity to do genetic testing, it took me a while to really make the appointment and move forward with it. And after you watch someone you love go through cancer, the thought of going through that yourself is really hard. But what I've come to understand and what I like to share with patients now is that the result of that test is just data, right? It's like we check vitamin D levels and we adjust nutrition and sometimes supplement based on those results, right? And so in a similar way, genetic testing is giving us information that helps us provide more personalized care, and always ends up in better outcomes for patients, right? So that's kind of how I like to think of it when I'm talking to patients. Yeah.
Thank you for sharing that. I'm sure someone will resonate with that. Moving on to the topic of breast reconstruction and in your personal experience, specifically natural tissue approaches like deep flat. For those unfamiliar, can you explain what the deep flat procedure involves?
Sure. Yeah. So just to kind of give a brief explanation. In general, as patients who are deciding between different reconstruction options, we're given three main choices. Aesthetic flat closure, which is choosing to remain flat and not do any other reconstruction. The second one is implant-based reconstruction, and that's one that most people are familiar with. But then there's also flap-based reconstruction, which you'll also hear called autologous reconstruction, or like you said, natural tissue reconstruction. And so this is when your plastic surgeon is essentially taking your own tissue and blood vessels and grafting those in, and using those to rebuild the breast in place of like an implant. And so the name will be based on the specific site that they take it from, which is the donor site. So for me, it was deep flap reconstruction, and that was because the vessel that they're grafting in is the deep inferior epigastric perforator artery, and so that's why it's called deep flap reconstruction. But sometimes you'll hear like tug flap, depending on where they're taking it from your body is where the name is really stemming from.
What led you personally to choose this method over the others?
So there are a few reasons, and one of them was both my breast surgeon who did my mastectomy and my plastic surgeon both told me that they had better patient satisfaction and lower levels of post-op pain in patients who chose deep flap reconstruction. So that was one reason. Another reason was because I'm someone who would like to limit the number of surgeries I have. With implant-based reconstruction, a lot of times, the recommendation to me was to have those replaced approximately every 10 years, give or take a few years. And so thinking about having surgery every 10 years for the rest of my life felt like a lot to me. And I'm hoping to live a long time, right? So I wanted to avoid as much surgery as possible. And so while a lot of people think deep flap is, it's really long up front. I had my mastectomy and my deep flap reconstruction in the same day. Both my surgeons were in the operating room together, and it was about 8 hours surgery. So it's very long. And so that, I think that makes people kind of turn away from that option. But for me, the perk was never having to come back and do it again, hopefully, right? And obviously there are complications and things that can happen that's not always the case. But in general, the goal is one main surgery, a second surgery called the revision, which is where they kind of go back and fix everything up. And then that's it. So my hope is that I will never have to have surgery again, and having that light at the end of the tunnel for me was a big plus. I wanted to put it in my past and like move forward and be done with it and not think about it again. So that was another reason. I also knew people who struggled with what they think was breast implant illness. And so, that's not something that happens to everybody, but, something that was in the back of my mind when I was considering my options. And the thing that really drove my personal experience and my decision to choose deep flap reconstruction was watching my mom's experience with implant-based reconstruction, and her experience with implant-based reconstruction was very hard. She had a lot of complications, multiple surgeries, lots of infections that they linked to her implants. And so I had a little bit of PTSD from that. And so that really honestly probably was the thing that played the biggest role in my decision to choose flat-based reconstruction. And so, but I mean, yeah, those are the main reasons I think for me. And it's so personal and different for every person, but those were my driving factors in my decision.
Thank you for sharing your story. What are some questions that you wish more patients would ask their surgeons before making a decision on breast reconstruction?
Yeah, I love this question because I talk to so many women who have gone through breast reconstruction, and they say things like, I wish somebody would have told me, this or that. And so I think about this a lot. And some of the big things that I feel like patients say to me that they haven't been told or feel like they didn't get the information about were all of the complications that are possible. And so, understanding and making an informed decision, you have to understand the complications as well. And so one of the things I urge people to talk to their surgeon about is like, tell me what complications are possible, because knowing one thing or another might change your mind. And each surgery comes with its own list of complications. And of course, not all of them are going to happen to you, right? But understanding those is a big part of making that informed decision, and the best choice for you. And so that's an important thing to ask. Also, because flat-based reconstruction isn't done by all surgeons, all plastic surgeons, it's a specialty called microsurgery that they have additional training in. Sometimes patients aren't offered flat-based reconstruction as an option. And so something that I encourage everyone to ask their plastic surgeon is, are you giving me all of the options that are available to me? And so, even the ones that you don't offer yourself. So that's an important question, I think, to ask when you're considering different options. And then if you are choosing flat-based reconstruction, one of the things that I think made a huge, huge difference for me personally was that my surgeon used something called a T-stat, which monitors perfusion after reconstruction. And it is this great new tool that they have that sends information to your surgeon's phone. And so it keeps you out of the ICU. It lets you rest more because your nurses aren't having to assess you as frequently. And so that played a big role, I think, in the amount of time I was in the hospital and my recovery. And so I would recommend asking your surgeon if they use that, because looking back, I think I would be sure to choose someone that did, if that's a possibility for you. And then the only other thing I can think of is the pain protocol that they follow makes a big difference in your recovery and healing. And so my surgeon used a pain protocol called the ARAS protocol, which actually starts before surgery. And that made a huge difference in my recovery. And research shows in general that you have better outcomes and better lower patient pain in the post-op setting when your surgeons use that. And so that's something I always like to bring up so that patients know that that's something they can talk to their surgeon about and see if they follow a pain protocol like this, and so that they're better prepared and have better recoveries.
Such helpful tips. Thank you. How do you think clinicians could better present all the options to the patients in an empowered way rather than overwhelming them?
So I think in these situations, as patients, we're always going to feel overwhelmed, right? It's so much information, and a lot of times it's new. Something that I've really come to appreciate as a patient is um, having providers who take the time to sit and explain and answer questions. And a lot of patients, I feel grateful because I came into this with a medical background. And so um, I was a little bit ahead of the game, but I talk to so many patients who are just, have no understanding of anything and what's going on, or like how to even make these decisions. And so the more education that we're giving patients, the better. And I know that's not always possible in this day and age in like the healthcare world that we live in, right? But I don't, I think that having your questions answered is such a big part of the whole experience, and like really feeling empowered and having all the information you need to make the best decision.
For sure. That is something that we are always saying here, is that communication is key. And again, in this case, communication is key. Let's switch topics. I would like to focus on nutrition and lifestyle. How do you see the role of food and lifestyle in both cancer prevention and survivorship?
I think it plays a huge role. And it's one of the things that I love. When I started out and I got my genetic testing results, one of the first questions that I asked my doctor when I knew I was at high risk now for these different types of cancer was, okay, what can I do to reduce my risk? What should I eat? Like, that's one of the big, and I think a lot of people feel that way too. Like, you really want action steps. And the response that I got was, maintain a normal BMI, no alcohol, no tobacco, eat a healthy diet. And so I was doing those things already in my life. And when I asked specifically about diet, I felt like I couldn't really get a good answer. I don't know, everyone has a different opinion on that. And so I think that's important though for as providers to understand that having those steps and that thing to hold on to, that thing that you have control over, is so important. And so that's kind of what drove my passion in nutrition, and why I went back to school, is because I'm someone who wants all of the information and can make an informed decision, right? And so um, what I've learned, which I think is really cool, is that on the oncology side of things, I've been through like chemotherapy courses and things that talk about targeted therapies and how we can target specific like cancer pathways. Um, and that's how the medications are targeting cancer for treatment, right? And then on the other end, I was able to focus my research in my master's program on specific foods that are also targeting those pathways. And so I love that. And I think it was so empowering to me to see that, not that you have to choose one or the other, right? But that you have both of these options that are like targeting those cancer pathways and can make such a huge difference. And so I think a lot of patients feel like, especially in the hereditary cancer community, like, you have a cancer gene, you think, I am just destined, like, this is my destiny, like, doesn't matter what I eat, it doesn't matter, I have this gene, and so I'm either gonna get it or I'm not. And it's just not true. So I don't know. I think nutrition and lifestyle is a powerful tool. I've done a lot of research in the nutrition aspect, but also things like exercise and sleep and stress, and all of those things play a role in cancer development and progression. And so I like patients to understand that even if you have this high risk, you can make a difference. I like to describe it as like a bucket filling up with water. And so if you're somebody who has a high risk genetic mutation, you kind of start with a certain level of water in your bucket, right? And the goal is to keep it from overflowing. And so as we're making all these changes and implementing these healthy choices in our life, it's like you're poking a hole in the bucket. And so every choice you're making is poking a hole and kind of draining some of this water, right? And so regardless of where you start, whether you have a mutation or not, or family history or whatever it is, you can still make a huge difference by implementing these changes. So I love that. I don't know.
I love that idea, and it's such an easy way to understand how it really makes a difference. Um, what are some common myths or oversimplifications you encounter about nutrition and cancer?
Okay. So there are a lot, right? I think it's so hard and it can be so overwhelming for anyone who is at high risk or has a new cancer diagnosis to try and sort through all of this misinformation that is thrown at us, especially in a social media environment. But some of the top ones that I hear and see from other people or that there's like one specific diet you should be doing. And the more I've learned about nutrition, the more I feel like it's so unique to each person, right? And so while there is a lot of research and things that we can do that we know is is helpful in general to most people, it's also important to understand that your genetics and your environment and all of these things play a role. And so you can be perfect in every way and still get cancer. Cancer is just a different kind of beast, you know? So, there's no perfect diet. There's no 100% guarantee, but like we were talking about before, you can make a huge difference by implementing a lot of these changes. So that's one myth that I hear a lot. Like you should be doing keto or you should be doing, certain diets. And while it might work well for one person or one type of cancer, it's not a general, you know, um, doesn't work in general for most people all the time. So um, another thing that I hear a lot is that you should avoid fruit, and I am not of the opinion that that is beneficial. I think fruit and vegetables, sometimes I've even heard people think that they should be avoided for one reason or another, and um, there are so many anti-cancer benefits and nutrients and all these polyphenols and flavonoids and things that are, like I was saying, can target these specific cancer pathways. I am a believer in fruit and vegetables, and the more that you get, um, the more helpful it is to reducing your risk. And so that's one big myth I hear sometimes, especially with like fruit and the sugar. People think that they should avoid it for the sugar content, and I disagree. So that's another one. And then I hear a lot of people and see a lot of people who think that supplements are like the answer to reducing their risk. And while there are specific supplements and at times they can be helpful and like if they're targeted and used to fill the gaps, I don't think they should replace a healthy diet and lifestyle. And again, there's no one thing that can really fix or reduce your risk 100%. And so those are some of the three big ones that I hear. But
Yeah, thank you. How do you balance evidence-based recommendations with the personalization, especially in a space filled with confusing information?
yeah, I love this question. I am a believer in research, and I think it's a great tool, but I also believe that it is imperfect and evolving, and um, that so in general, I think that we should start with the research and then adjust based on personal evidence. And so I think patients should really learn to pay attention to their bodies and what it's telling them. And, we have different signs and symptoms for a reason. And so um, listen, right? So pay attention to the research, but also understand that um, you should adjust based on your own unique needs.
For sure. For someone newly diagnosed, what are three realistic first steps they can take to support themselves through nutrition and lifestyle?
Yeah, sure. So I think the biggest thing is that the first thing that most people want to do that I talk to, and I felt this way too when I got diagnosed, is that you try to take away all the things that everyone is telling you. Um, are bad for you, right? Even the people that aren't educated on the subject are giving you advice on like what to take away. But I think for me, the most powerful mindset shift happened um, when I stopped focusing on what to take away and started focusing on really adding the good things. And so I talk a lot about filling my plate with purpose. And so when it comes to like food and just life in general, adding things that bring good to your life, whether it is, a person or a food or adding exercise, things that we know can reduce your risk, better sleep. I know this is more than three things, sorry, but um, focusing on adding the good things is really helpful and a little bit less overwhelming, I think, than trying to take so many things out of your environment in the beginning.
Yeah, I love the idea of filling your plate with purpose.
Yeah, thanks.
Um, let's see how you do it yourself. On a personal note, what does a typical day look like for you now in terms of eating and moving your body?
Yeah. So in general, I do like to start my day from a calm place. I think the way that we start our day kind of sets the tone for the rest of the day. And so, in regards to like stress and overwhelming things that are going on in your life, I've found that if I start my day from a calm place, it really helps with the whole rest of my day. And so, everyone has their own thing. I have a swing on my back porch that I like to spend a few quiet moments. And I guess some people could call that meditating. I've never been very good at meditating, but I will sit on my swing in my backyard. Some people like grounding, some people pray, some people, everyone has their own thing, but whatever it is, make it a point to start your day with intention and from a calm place. And so that's a big part of my day, something that I prioritize now more than ever. Um, I also try to eat a lot of fruits and vegetables. Um, the recommendation is 5 or 6 a day, fruits and vegetables. I'm an overachiever in this area, and I try to go for, like, 8 to 10 because of all the benefits that it can bring, um, in regards to cancer, and so, um, lots of fruits and vegetables. I stick to a whole foods diet. Um, I avoid processed foods. I also like to start my day with exercise. Everyone has a different time of day, but for me, starting in the morning and getting that done, you kind of have that checked off your list. And um, so I think, yeah, prioritizing those things are a big part of my day. And then just making sure that um, I think it's important for everyone to just kind of like tune into what's going on around you and recognize when your stress levels are going up and just kind of learning different ways to adjust and um, yeah, anything that brings peace to your life, I guess is my goal during the day to add. So.
Yeah, thank you for sharing. Moving on to self-advocacy, what does this term mean in your practice?
So self-advocacy, that was actually a big part of my story. I don't know how much you know about that part, but when I was doing my screenings, I was alternating between mammograms and breast MRIs, and my breast MRI came back with an abnormality, and um, they thought it was a lymph node. I did follow-up testing. Um, the provider who read my report that day um, was not sure what ATM mutation was, and I had to explain that to him, but also recommended just following up in 6 months. He thought it was a lymph node, same thing. Um, I pushed for more testing. I followed up with 2 surgeons in their office, breast surgeons who did ultrasounds in office and said, 99% sure this is not cancer. Um, just follow up. And I was just feeling really uncomfortable with that answer, especially knowing my risk. And so I requested a biopsy, and sure enough, it ended up being cancer. And so um, self-advocacy has become so important to me, and I do have a unique perspective, I think, because I am working in healthcare, and I work with some incredible people and doctors who would like, bend over backward for their patients, right? They're great, but also understand that they're human, right? Like we're all human. Nobody knows everything, and sometimes I really feel like we have this false expectation that doctors have all the answers all the time, and that's impossible, right? In the real, like, that's impossible for anyone to know all the answers. And so I think I try to make sure patients know that. And when something doesn't feel right, say it, say something. Um, Something that I've learned as a nurse is that when a patient has a gut feeling about something, you listen. Before oncology, I worked a lot in cardiac. That was a lot where I spent a lot of my career. And there was something, and we learned this in nursing school, right? It's called this feeling of impending doom. And when a patient says they're having that feeling, a lot of times it means something's going to happen. And it did. And I watched that happen so many times. And so I think it's important to remember that those gut feelings that we have are sometimes the best diagnostic tools that we have to use. And so if you don't feel like you're being heard, find another provider or, keep pushing and that's okay. But just, yeah, make sure that you say something if you feel like something's not right.
What are some examples of ways patients can advocate for themselves during screenings, diagnosis, or treatment? You have said that if they feel it in their gut, they should say it, they should speak about it, or even try to find someone else. Do you have any other tips or recommendations?
One of the best questions I can say that you can ask a provider when you're feeling like, or if you don't know what to ask, or if you don't feel like what they're telling you is the direction you should go, um, that I think if you ask the question, are you 100% sure? And are you willing to document that in your note? I feel like that's a good question. Are you sure that this is the best choice for me? And will you document that in your note? Because I think sometimes that helps you get a better, more clear answer, right? And if they're not 100% sure, then let's do more testing, right? And I don't think anyone's really 100% sure, but it's always okay to request more testing if you don't feel good about their answer.
Thank you. From your perspective, what role does information literacy play in patient empowerment?
It's a huge part. Um, if we don't understand the information that's being presented, we can't make informed decisions, right? And so, something that was very eye-opening to me recently was I got to go on a trip to the Mediterranean. So we did Italy and Greece and Turkey, and that was my first international trip, and it was very eye-opening to me. And I have patients, who we use interpreters for all the time, but um, being out of my own country and, like, realizing how hard it is to communicate, um, was very eye-opening to me, and just I really thought about my patients and how they feel when they're coming in, especially when it's a health-related situation and you're trying to manage your care and not understanding would be so scary. It's scary when you can understand, right? But worse if you don't understand, and so health literacy it's so important. And um, from the provider perspective, I feel like um, that's something that's a priority to me. I really want to make sure that the education that I'm providing is on a level that patients can understand, and that's also something that I try to share on my social media is explaining hard concepts in ways that people can understand. And in my master's, we did a project that we had to do a presentation on a fifth grade level because in our country, at least, that's where the majority of the people sit at a fifth grade level, and that was the hardest project I've ever done, trying to bring a very hard, complicated topic and put it at a level where most people can understand is harder than we think. So, important from the provider's perspective, to ask and make sure they're understanding and following up and asking them questions so that you know that they understand before they're making these hard choices.
For sure. Would you agree that we need to train more professionals in lifestyle medicine, nutrition, exercise, just to have more information out there also for providers?
100%. I think, even as going through nursing school, I feel like the nutrition information that I received was very limited, which is why I chose to pursue my own education afterwards. But Yeah, I think there's definitely a need, based on what I've seen from my own patient experience and the questions that I asked, and also just in conversations with colleagues, that it's definitely an area that we could improve on for sure.
Now, finally, what's something that you have learned recently, professionally or personally, that really stuck with you?
So, something that was very, very recent, actually last week, I was talking to um, a GI specialist in an oncology clinic, and we were talking about patient populations, and she told me that they have seen a dramatic increase in um, 20 and 30-year-old patients coming in with colon cancer diagnoses. And I think we're seeing this across several types of cancer right now, but it really like stuck with me because she said they were seeing 1 or 2 new patients every day just in their clinic in their 20s and 30s. And colon cancer is one of those cancers that is 100% preventable, right? It's like one of the only ones. If you're doing your screenings and you are following up and doing everything you're supposed to, they can really 100% prevent that when they find polyps and they can remove them. And so I don't know, that was something that like I haven't been able to stop thinking about it because there's so much we can do, right? Obviously screenings don't usually start till later, but knowing your family history and reporting that, and genetic testing and nutrition and lifestyle changes that you can make, implementing things to improve your gut health, things that there are so many things we can do to make a difference. And so that was just, I don't know, something that just very eye-opening when you hear the numbers like that and think back to like the education. We're really not getting enough education on this, especially in those younger populations who we're starting to see more cancer in, and we need it. So I don't know. One of those things I don't forget, you don't forget.
For sure. I know I won't forget now. So, um, Krista, before we wrap up, if you could share one message with someone who has just found out they carry a high risk gene mutation, what would it be?
Okay, so I think I would say, in my experience as an oncology nurse navigator, I have had the opportunity to work with so many people, and almost on a daily basis, I am meeting with patients in very similar situations to me. I was diagnosed, my breast cancer was stage 1A, but I realized that I really dodged a bullet because I'm watching these patients come in at the same stage, just like 1 or 2 differences in our like testing that is making a huge difference for like what they're having to do treatment wise. And so I realized that I was very lucky, and I think it's hard to make these decisions, right? You're faced with all these screenings and just whether or not to have surgeries if they're an option for you, and the decisions feel really, really hard, almost impossible sometimes. And I don't know, I've thought so much about that, and how genetic testing can really make a huge difference. And I just think the thing that I think I would say to anyone trying to make these hard decisions is that I know that those decisions are hard, but the option to choose your hard and everything that comes after is really a gift. Um, Not everyone gets that opportunity.
Thank you. That's very impactful. And Krista, thank you so much for sharing your story, your insights, and your incredible deep of knowledge. It's clear that your work is rooted with both compassion and clarity. I know our listeners will like this episode very much. I know I did. So thank you for being here with us.
Thank you for having me. I really enjoyed it. It was nice.